We would like to use this video to inform you about hepatitis D. We recommend that you contact your doctor if you have any questions about your situation. What is hepatitis D? Hepatitis D causes inflammation of the liver due to an infection with a specific virus, the hepatitis D virus. The special thing about the hepatitis D virus is that it relies on another virus, the hepatitis B virus, to reproduce. An estimated 12 million people are affected by hepatitis D worldwide. The condition is particularly common in Mongolia, the Republic of Moldova, in Brazil, in Russia, as well as in Vietnam and some countries in West and Central Africa, among others. How is hepatitis D transmitted? The hepatitis D virus is transmitted through contact with blood and other bodily fluids of infected people. For example, when using contaminated needles and injecting equipment, during injury-prone and unprotected sexual contact, and when tattooing and piercing with an infected needle. Infected mothers can also transmit the virus to the child during birth. There is no risk of infection when shaking hands, hugging someone, kissing on the cheek, or even when breastfeeding. Those who are aware of the transmission routes can effectively protect themselves from infection. For example, by only using sterile utensils when taking drugs and not sharing them with others, practicing safer sex, only getting tattoos and piercings done under sterile conditions, and not sharing personal bodily hygiene items such as toothbrushes or razors with others. The simplest way to prevent infection is to be vaccinated against hepatitis B, because if you are vaccinated, you are also protected against hepatitis D. What happens after an infection and what symptoms can occur? The hepatitis D virus, as already mentioned, is dependent on the hepatitis B virus in order to replicate. You can therefore only contract hepatitis D. If you are infected with the hepatitis B and D viruses at the same time, this is called simultaneous infection. Or, if you already have hepatitis B and are also infected with the hepatitis D virus, also called superinfection. For those affected, this distinction is very important. This is because with a simultaneous infection, the immune system is mostly able to eliminate the hepatitis D virus. This is not the case with a superinfection. Here, the disease becomes chronic in up to 9 out of 10 patients, meaning that the virus can still be detected in the blood 6 months after infection. Chronic hepatitis D progresses at a rapid rate, and those affected develop liver cirrhosis and hepatocellular carcinoma more often and earlier than with hepatitis B alone. Important: you can die from hepatitis D if it is not detected. Symptoms such as fever, severe fatigue, loss of appetite, nausea and vomiting, or yellowing of the skin and eyes typically occur in the first few weeks after the infection with the virus. These symptoms can be mild but also very severe. In exceptional cases, particularly following a superinfection, the body can react excessively, resulting in massive damage to the liver, which can even be fatal under certain circumstances. If hepatitis D becomes chronic, then it often progresses largely without symptoms or leads to general symptoms such as tiredness and fatigue. Many infected people are therefore not aware of their infection for a long time, allowing the disease to progress unhindered and the liver to become increasingly damaged. It is only in the very advanced stages that clear symptoms appear, such as water retention in the abdominal cavity, bleeding in the esophagus, or states of confusion. Chronic hepatitis D is regarded as the most severe form of viral hepatitis, since it leads to such consequences and complications a lot more frequently and quickly than hepatitis B alone. It is therefore very important to detect hepatitis D as early as possible. How is hepatitis D treated? Hepatitis D can be treated with medication. The objective is to stop the virus from replicating and therefore protect the liver from damage. Discuss with your doctor which treatment is best for you. Hepatitis D cannot yet be cured. That is why it is all the more important to avoid getting infected in the first place. Therefore, please be careful and pay attention to safer use and safer sex. And remember, a hepatitis B vaccination also protects you against hepatitis D.